And in the old days, we were told that the product would last months, if months, maybe it extended to a year. What are your thoughts on that now?
Yeah, absolutely not. But there's other modalities that we can now move to maintain the appearance of the skin without just replacing volume that does not need to be replaced. You have to use all the tools in the toolbox. It's like akin to repairing a house. You don't do it all with a hammer. You need many different modalities, different tools.
Temporary filler is not totally temporary. Yeah, and I think most people understand that now.
So I have had fillers, biostimulators, I have done skin boosters, I've done tons of neuromodulator, I'm obsessed. And I love fillers because it's an excellent tool.
So what's your final take? Filler, friend or foe? Biostimulators, friend or foe?
Hi, everyone. Welcome back to Unfiltered. Today, we have another guest, Nurse Hannah, who many of you may know from our clinic. Hannah's been working with me for a number of years, and she has cultivated a passion and skills in aesthetic medicine that I always tell her I'm very proud of her because she takes her job so seriously. She's so passionate, and she's always on the leading edge of education, leading edge of education, making sure she's up to date with the newest and greatest treatments. So today we're going to chat with Hannah about her perspective on a number of the treatments that are out there in the marketplace. And she'll give you some thoughts of what she thinks works, what may be a fad. Okay, I'm going to turn over to Nancy, who's put together some questions for Hannah, and then we'll get into some back and forth discussion.
Hi, everyone. Well, we're talking about filler today, and there is really so much to talk about, but we're going to start off with the most basic, information. So what is filler? What does it do? What does it not do?
Okay, amazing. So filler is hyaluronic acid. It's a sugar molecule that's naturally occurring in our body. But this one is made in a lab and cross-linked so that it can last a little bit longer. We can alter the textures and it can restore volume beautifully. That is what it is so good at.
So when you say there are different textures, they make different textures because different areas of the face need different thicknesses.
Correct.
Okay.
Exactly. Like you don't want to put in your chin what you would put in your lips and vice versa.
You did a very good post yesterday.
I did, yeah.
Why you mentioned that. Yeah, because the filler that we would put in our lips would be thinner.
Correct.
Under
Thinner,
the eyes.
More malleable, more forgiving to the dynamic movements of the muscles. And then anything that's going to go deep down onto the bone, you want structure, projection. You don't want it to move.
Okay. Now, what does filler not do? Does it lift the face?
Filler does not lift. Filler will not change much of your skin quality. It is excellent at volumization. It is a wonderful tool for that only.
Now, there are different products on the market. How do people know which brand their provider is using and which brand is better than the other, or what works in their face? How does the patient discern?
So, really interesting topic that I think about all the time. I want clients in general to move away from thinking that they're exchanging money for a product. The product is not what they're purchasing. They're purchasing the skill and the art and the experience of that injector. The tool is less important than the artist that is holding it and injecting it. So brands aren't as important as who you're seeing.
Okay.
So Hannah, I just want to ask you a question about the different product lines, because there's certain clinics that are touting one product over another. At our facility, we use a multitude of filler products. And in my opinion, most of the products have upped their game. They've all improved their versatility, their range of products from thick to thin for specific uses, for lips to tear troughs to cheek augmentation or jaw augmentation. What are your thoughts of the different products that are all under the same chemical banner of hyaluronic acid?
Yeah, I think in general, they have done a much better job with the product type. And the specific problem that was happening in the past was the amount of preservative, BDDE, which is the preservative that cross-links the hyaluronic acid so it lasts in your body. The problem with that is if you use so much of it, you're going to get inflammatory responses. So, in the past, the products had very high amounts. And I think over time, they're understanding that people's bodies start to reject it over time. And they're reducing the amount of BDDE so that it's more like your own human tissue.
Right. And what about, there was that Vicross product. Is that what the problem was? Because some people would love it and it would last a long time and it was actually considered a premium product. And then some people would have rare reactions to the product. Was that also a result of the cross-linking of the Vicross technology, they called it?
Yeah. So listen, I think that anyone could react to any filler, but I do think that there's higher incidences of reactions to the Vicross. I do believe that product's still around. I don't know if we can, I don't think we're supposed to mention brands or anything like that. But certainly as an injector, you have the skill and the knowledge to pick which ones you think are going to suit the client. And also client selection and taking a very thorough medical history is so important. Do they have autoimmune diseases?
Are they ask that question. Right? If someone does have an autoimmune condition, how does that change your treatment plan?
Correct. So I may veer away from things that are very permanent or are going to stick around for a long time. I'll ask about how active their autoimmune disease is. When was their last flare-up? All of these questions are super important because, yes, although the Vicross product had higher incidences of problems, people can have problems with any filler.
Yeah, absolutely. And then tell us a little bit about how do you manage, or what's the commonest sort of things that you see? I know there's catastrophic things that can happen, like blindness or damage to the skin, known as vascular occlusions. But tell us some of the more common pitfalls that you run into with the product.
The more common pitfalls that I'll see in general could be things like pillow face, swelling, migration, things like that. I'm not necessarily saying that I have these problems commonly, but this is a common issue in the industry. Given where I work, I'm fortunate I'm in a plastic surgeon's office. I see a large demographic of patients. So I see people with all kinds of complications, people who have been getting fillers chronically for years. So I do come across this often. And I have some thoughts about why this was happening so frequently in the past. But I do think that as an industry, we're moving towards becoming so much more savvy and conservative with how we use fillers so that we're avoiding these kind of complications.
And in the old days, we were told that the product would last months, if months, maybe it extended to a year. What are your thoughts on that now?
Yeah, absolutely not.
What are your thoughts on that? You do facelift surgery. When you open someone's face, what do you see?
No, I think it lasts a lot longer than that. I see it all the time when we're doing surgery on patients who have distant histories many years before. Temporary filler, that they say they haven't done filler for many, many years. We take their word for it. Sometimes we recommend dissolving areas that look puffy or swollen that we assume may be filler. But some cases, patients may look okay and it may be hard to tell. We go in surgically and we find there's lots of products still in their faces. So is that
not the answer? Temporary filler isn't?
Temporary filler is not totally temporary. Yeah. And I think most people understand that now. And it's whether the filler that's put in on day one has undergone some kind of change to the filler that may be present 4 or 5 years later, because likely there's been some chemical alteration of it. It's still hyaluronic acid, but likely the physical properties of the product has changed, allowing it maybe to migrate or move or cause some tissue swelling in the older version of the product as it's sort of degraded slowly. The trouble is that if that's not identified and then a new injector sees the patient and continues to add more and more and more on top, presuming that the old filler is all gone, then you end up running into complications where patients appear overfilled or pillowed face or doughy looking or water retention or swollen. So that's the type of stuff we obviously are aware of and try to avoid.
But don't patients come saying, I'm sure you've seen this, where they are like, well, it's been a year since my filler, I need a touch up, just because they think it's temporary and they need it's time for a touch up. And they also can get a little bit dysmorphic where they may not see, they don't really need it.
Right. So listen, on one aspect of it not being so temporary, the positive part about that is if they have a favorable result, this is really good value for money, right?
Yeah.
And there is also some biostimulatory effect of having filler placed in the face that is excellent for collagen production to some extent. So it's not all bad, but certainly I think that in the past, there was a lot of repetition of the product, and that's where the pillow face came in, and you're seeing complications like that as well. I do think that there are many cases of people who have had fillers occasionally over the years and have gorgeous results that have maintained the volume of their face appropriately. So dysmorphia, very rare, very real. There is certainly a perception drift. This is why photos, before and after photos, every angle, all angles. I even like to start taking videos to really understand the face, because I have this with my own clients that I've seen 5-6 years ago that we did beautiful filler on at the beginning to restore volume loss. And they're coming in, but like, I think my cheeks are deflated. And we show the before and after, and it's all still there. So, but there's other modalities that we can now move to maintain the appearance of the skin without just replacing volume that does not need to be replaced. You have to use all the tools in the toolbox. It's like akin to repairing a house. You don't do it all with a hammer. You need many different modalities, different tools.
So you've been doing filler injections for many years. Do you find there's been a shift in, let's say, even the last year? Because I do a lot of consultations with patients, and I hear a lot of patients say, I'm not doing filler, I'd rather do surgery.
Right.
So do you see that?
Most certainly. I see a decline in the requests for filler and the amount of filler being performed. I think this is multifactorial. Partially, my view on how long it lasts and how long it should be repeated has shifted. And also the clients have become fearful from all the medium noise. So what I think about what's going on in the media right now is that you have these two polarizing groups. You have plastic surgeons that are fear-mongering with filler, saying it's totally permanent, it's causing scar tissues, your surgeries are not going to turn out, you're going to get pillow face. They're on that end of the spectrum.
Ironically, this surgeon doesn't say that.
That's wonderful. Little more balanced view. And then you have the filler companies still wanting to sell their product, their bottom line, right? Telling you do need to touch it up every 6 to 12 months. What you really need to understand is the underlying biases. The surgeons who are saying you should never be doing filler benefit from you doing a facelift a little bit earlier in life. Maybe you'll come in twice in your life rather than just once. Maybe you'll even never do filler and come to them at a much younger age. The filler companies benefit from you repeatedly placing filler. The truth probably lies somewhere in the middle. Small amounts of filler, being very conservative, appropriate with it, placing it in the right plane. This is so important. All of that are excellent tools, very predictable tools that we can use to restore volume. I think this downtrend will come back up again with filler. I think that with any tool that is very effective at what it does, it has the potential to be abused. But as we know more about it and we're able to be police the industry a little bit better, it will come back up because it's so effective at what it does. And very little downtime and not so costly given how long it lasts.
I agree 100%. My perspective is very similar to yours. I think it's a great tool when used appropriately. I think the messaging is that it lasts longer and probably we should be more conservative in its application. I also find that patients should be really like not bouncing around, because I think the big issue is when patients bounce around and go to multiple care facilities and they get a little bit here, a little bit there. No one's really really
it's
aware.
not true medical history.
It's not great medical care in general because they don't really know. Patients forget what they've had done. The records are all over the city, and they may have all sorts of different products in their face, and then you end up with complications, and you may end up really not doing yourself a favor. In terms of how it affects surgery, which is your question, I think certain products do affect surgery more than others. I think that the biostimulants such as Sculptra, Belafil are much more of a product that can affect surgical intervention, making the surgery more difficult.
But it doesn't affect the result, just the...
It affects the technique. The technique can be harder to deliver the same result because you're working through collagen scar tissue, which is man-made, which you've done to create some new collagen. You've created some adhesive properties where the tissue planes may be more sticky. So in circumstances where a surgeon's very comfortable with the operation, we can work around it. And if a surgeon's not comfortable with it, or they're relatively new to facelift surgery and a patient's had all sorts of things done, they may run into technical trouble or not be as confident in delivering the same result, meaning they may chicken out and do a partial deep plane rather than a comprehensive deep plane because there's all adhesions and scar tissue within the face.
May I ask a question about that? So with specifically biostimulants, again, with every tool, we're becoming more savvy. If it is placed in the subdermal layer only, avoiding all the dynamic muscles and the SMAS and not going any deeper, do you still think that you're going to have issues separating the layers?
Only at the beginning of the procedure, and it depends on what operation the surgeon prefers. So I do a deep plane lift. So in my procedure, we've seen that many times. And the initial part of the incision, lifting up a bit of a skin flap, could be more sticky. But you're not near vital structures there. Like You're not near the facial nerve. Then we go deep, and you're right. Once we've gone deep, and we work collaboratively, so I know you've done it superficially. So normally we're able to go deep, and we're deep to where all the sculpture lies. And you're right, it's just like a regular facelift. But if a surgeon does primarily a skin flap and they don't work in the subsmass layer, then they're going to find it more difficult the entire operation. They're doing a different operation where they're working in the layer where the product was placed. Whereas, or if a injector injects it in multiple layers of the face, it may make it tricky for my type of procedure.
And you always remind me that the skin flap surgeries are not as long lasting and as robust as your deep plane facelift. So maybe not even a surgery you want to seek out.
Good point.
The next thing I wanted to talk about, since we're on the topic of layers of the skin, is, again, historically, I think injectors didn't really understand facial anatomy the way we do now. And we're just being quite artistic and sculpting with fillers willy-nilly in all layers. And I think we now know as an industry, there's only really two safe layers to be in, periosteum and subdermal, maybe subcutaneous, but you definitely don't want to be in the sliding planes between the SMAS and the muscles moving. And that's where you run into issues like filler migration, pillow face because you're blocking lymphatics, the filler breaking down in a strange way because it just doesn't belong in those kind of layers. What do you think about that?
I don't know. Every few years, there's sort of new discussion about the safety and best practices. And I find sometimes these things make sense to me. Sometimes they're academic in nature and it's hard to really prove clinically. I've always been sort of comfortable injecting hyaluronic acid in multiple facial layers because I do find that it's a product that some patients do benefit from being somewhat artistic. So, but in general, I agree with you. I think in areas that you want to volumize, subperiosteal or right on the bone is going to be a very safe area. For cheek augmentation, lateral cheek augmentation, chin augmentation, I would inject deep. There's really no advantage to going sort of in the subcutaneous tissue and the soft tissue, like into the mentalis muscle versus going deep. It's all going to bring forward the chin projection or the cheeks. And you're not altering lymphatics because you're sort of underneath everything.
Right.
So I agree in those concepts. In terms of areas like nasolabial folds, you may have to sort of layer it a little bit into subcutaneous layers, which I don't think is necessarily going to cause lymphatic drainage.
Yeah.
But I think if you're putting it sort of in all the layers, all the face, and it's in the deep layer, subperiosteal, subcutaneous, in the soft tissue around the malar mounds, you can cause some lymphatic issues for sure. So I think being mindful to all of those things for sure it's a reasonable concept to keep in the back of your mind. But I've never been a stickler to absolutism in aesthetic medicine.
I want to touch on under eye filler. I would say I think I've seen, maybe you've seen a decline a little bit in people requesting under eye filler. That used to sell off the shelves. And now I find more people are opting for lower eyelid surgery. And the beauty about our clinic is we offer all of the above. We offer laser resurfacing, we offer filler, we offer blepharoplasty, which is really nice because...
And fat grafting.
We were talking about going to a Medi-Spa versus a surgical center in a previous podcast. And when you come to us, the nice thing is that we offer everything. So there you can be rest assured that you're getting a very honest opinion of what would be best for you. So what's your take? Do you find that people have been shying away from under eye filler? Because I know there's the Tyndall effect that people can get from that.
I've certainly become more careful with my candidate selection over the years. There are a lot fewer people that I will offer under eye filler to. That being said, during my consultation, I will do a thorough assessment of the tissue in the area. check for fat pad herniation, the skin turgor, etc. And I'll give a thorough consultation, and I will underline all the options that are there, including surgery with Dr. Philip Solomon. That being said, not everybody wants surgery. There are many people who are afraid of surgery, or they can't take it because they can't take the time out of their life. So we'll discuss the risks associated with the under eye filler, that it may worsen their condition. Sometimes I will do somebody who is not the best candidate for under eye filler, and we end up with really, really nice results. But you have to lay out the risks and the options. You have to coach the client through it. And they need to understand that, it's kind of like a little bit of a waiting game. You never know if you're going to have a complication in 2 weeks, 2 years, 10 years, and that we'll need to reverse it. But if the client is aware, I do believe in some medical autonomy. If they're aware of all the risks, they understand what's associated with them, and they still want to proceed, sometimes you can get really nice results as well.
So let's talk about reversing filler, because it's kind of like liquid paper on pen. You can undo it a little bit, but does it undo it completely? So if somebody has a complication, filler migrated, we have a product that we can use that can help dissolve it.
Yeah. So hyaluronidase, which is the antidote to filler, breaks down the hyaluronic acid bonds so that the sugar molecules can kind of dissolve in the body. But what we now know is that the BDDE, that preservative I was telling you guys about earlier, does not disappear. That will always remain to some extent. Most of the time, the hyaluronidase does a very good job of reversing any aesthetic effects, or if there's lymphatic effects that are unfavorable, it will get rid of it. Usually it does quite well, but I can't make that statement for everyone because this is medicine after all, right? Skin tissue, humans are not 100% predictable. Some people will not do so well.
Can we talk about your aesthetic? What do you have in your face? What do you have in your face?
You know what? Most treatments that I do to my clients, I have tried. One of the reasons is maybe I needed them, and also I want to experience some of that so that I know what my clients is going through. So I have had fillers, biostimulators, I have done skin boosters, I've done tons of neuromodulator, I'm obsessed. And I love fillers because it's an excellent tool. Like, for example, if my weight fluctuates, what is going to get me back to a beautiful, youthful, plump contour faster than a little bit of filler appropriately placed?
Where would you put it?
Oh, for me personally, when I lose weight, I find that my temples go really hollow. So I like to fill the temple. That's a really nice area to do filler, very predictable with hyaluronic acid filler, and will instantly give you some youthful roundness to the face, not in a fat way, but just makes you look healthy.
Why is that? Why do temples that start to sink in? Why does it have an aging effect?
It's part of the aging process. As we look at patients as they go into their 5th, 6th, 7th decade of life, it often hollows out to get a scalloped look on that. There's a muscle that sits in a fossa there. It's called the temporalis muscle. There's some fatty tissue in that area. And as you exercise a lot, if you lose a lot of weight, if you're doing specifically cardio or runners, you can end up with hollowing in the temple area. So that's quite common.
So what's your final take? Filler, friend or foe? Biostimulators, friend or foe?
I'm sort of with Hannah. I think they're all different tools. And I think that we're fortunate enough to have industry partners in aesthetic medicine that have been constantly pushing the envelope to improve their products. And I think that they certainly can be used as a friend. Not everyone wants surgery, and everyone may be looking for non-surgical options. So at our clinic, and our philosophy has always been, as I've said in the past, 1 + 1 + 1 = 10. So you have filler and Botox as one arm of the anti-aging paradigm. You have energy devices with lasers to improve your skin quality, and then you have surgery. And combining all three of these often gives the best results, the most natural results, and gives you the most versatility of tools that we have, using whatever we can to improve your look. So I'm a friend, but I'm a foe about bad use of the product, overuse of the product. I'm a friend and a foe. But I'm a friend of filler, and biostimulants and energy devices and surgery, but they have to be done by experts who know what they're doing, who are going to use it appropriately, safely, and give you predictable outcomes.
Hannah, any final comments?
So final comment is I am so grateful to be in 2025 where we have so many options to beautifully restore the health and the look of our face. I think we're living in an era now where everyone is younger, more vibrant, more sexy, living lives to a whole nother level. And they want their face to match how they feel on the inside. And now we have options. And I just think that's amazing. Just make sure you are seeking out a professional that, first of all, looks normal and is going to be appropriate. And it's kind of a red flag if they're telling you to refill their face every 6 months, every year. Yeah.
You're so positive. You're so inspiring.
Thank you.
You look fantastic.
Thank you.
We appreciate your wisdom.
Thank you.
Well, thanks so much for participating in Unfiltered. Hannah's been saying, hey, we work together. Why am I not on Unfiltered? And I said, we will be showcasing you on Unfiltered. We'll probably have you back again.
I'd love to.
And thanks for participating. I think you're great on it. You were natural. You seemed relaxed. And I think you're
very
terrific at sharing information.
Thank you.
Thanks again for participating. And thanks for listening in. And we'll see you all back soon.